trust, because you cannot practice functional medicine if you cannot make a practice out of it, if you cannot function financially. So when we talk about making functional medicine's practice functional, we want you to be able to practice it and to be able to make a living doing it. I've been doing that since about 2008 or 2009, been strictly doing functional medicine, and have been much more successful doing this than I was practicing OBGYN, delivering babies, doing hysterectomies. You can make a living doing this, and you can enjoy medicine again, and you can also have time to pursue other interests, whether it's writing, whether it's teaching, or whether it's just being with your wife or your spouse and your family. And I think that is important for physicians to understand, that you have to live and you have to contribute to your family's lives, you have to contribute to the community, and if you're working 12 hours a day and you're not making a decent living, then you're a bad example for your patients. We're talking about oxidative stress and stress. You need to be an example. And Dr. De Silva is that type of example. I try to be that type of example. I don't take any medications. I'm not on any hormones. And I do a lot of functional medicine testing in my office, and I'm doing pretty well. And I'm 53, so I plan to be like that when I'm 57. I hope I'm like that when I'm 67. And that's what functional medicine is all about. How can we maintain maximum function for the longest period of time? And you do that by providing the body what it needs in order to function. And there is no physiologic pathway where drugs are a part of that pathway. So I'm not saying, if you have a heart attack, yeah, give me my epi, my Norepinephrine, do whatever you need to get my heart started again. But as soon as that acute situation is over, then I want to do things to make my cardiovascular system function better, whether that's getting rid of toxins, or whether it's getting rid of heavy metals, whether it's taking arginine so I make more nitric oxide so that my vessels open up. Whatever it is, I want to maintain maximum function for the longest period of time. And that's what functional medicine is about. Sometimes, people that say I practice functional medicine, and they don't really know what that is, but that's what that is. I want to maintain function as long as possible, and you do that by making sure that the body is not deficient in the things that it needs to function properly. So, okay, so I have